The president says there are a number of ways to make this better.
They're throwing away the mask right away. They're throwing away, and when you hear 55 million masks were ordered, I'm saying 55 million. How could it possibly be such a number? And I said, why aren't we sanitizing masks? You know, you look at the masks. I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks, and that's something they're starting to do more and more.
Is that something they're starting to do more and more, and is that good advice from the president?
So I would love to invite President Trump to come tour my hospital with me and see what my coworkers are doing at the recommendation of the CDC. We are reusing procedural masks, N95s, and face shields for as long as we possibly can in order to preserve them. We are wiping down the face shields with bleach wipes, but it's really impossible to sterilize the N95s or the procedural masks at this point. There's no liquids that could do that without destroying the fabric and their protective ability. The CDC itself has told us to continue to reuse these as long as we possibly can. I'll note for the president that on an average shift in the emergency department, I see somewhere between 20 and 30 patients. If you multiply that by all the patients that come through my ED, all the patients that come through all the emergency departments across the country, ideally we would be going through millions of masks a day. That's the safe thing to do to protect us and our patients. Unfortunately, right now we're not. We're reusing them. We're putting ourselves at risk as healthcare workers on the direction of the CDC. I really hope that we can soon see a federal system for distributing these masks and other supplies where they are most needed.